The topic of the tutorial is nerves of the neck. I, Dr. Alpana Kesar, will be covering this topic under the following subheads: cervical plexus, Ansa cervicalis, brachial plexus in brief, cervical sympathetic ganglia, cranial nerves in the neck, namely glossopharyngeal, the ninth cranial nerve, vagus, the 10th cranial nerve, accessory, the 11th cranial nerve, and hypoglossal, the 12th cranial nerve. Lastly, transverse cervical nerve. Cervical plexus. Cervical plexus is a network of nerves that is present in the neck. It is formed by the anterior rami of the first, second, third, and fourth cervical spinal nerves. These four nerves are connected to each other with the help of three loops. The cervical plexus forms in the substance of the muscles that makes up the floor of the posterior triangle within the prevertebral layer of cervical fascia. Anterior to it is present the prevertebral fascia and the sternocleidomastoid muscle. Posterior to it is present levator scapulae muscle, which is this, and scalenus medius muscle, which is this. Branches of cervical plexus. There are two categories of branches of the cervical plexus, which includes the superficial branches, that are the cutaneous branches which supply the skin. Deep branches include the communicating branches and the muscular branches which supply the muscles. Superficial branches of cervical plexus, which are the cutaneous branches that supply the skin of the neck and a small area of scalp. These cutaneous branches ascend on the posterior border of the sternocleidomastoid muscle and distributes to the skin of the neck and a small area of scalp just posterior to the ear. The cutaneous branches of cervical plexus are lesser occipital nerve, which is this. It has a root value C2, that is, its fibers are derived from the second cervical spinal nerve. It supplies a small area of skin in the back of the scalp, just behind the ears. Great auricular nerve, which is this, has a root value of C2 and C3, and it supplies the skin of the parotid region, ear, and the mastoid area. Transverse cervical nerve, which is this, has the root value of C2 and C3, that is, the second and the third cervical spinal nerve contribute to its fibers. It supplies the lateral and the anterior part of the skin of the neck. Supraclavicular nerves, which is this, has a root value of C3 and C4 and supplies the skin over the clavicle and shoulder as far as the first rib. Muscular branches of cervical plexus. Several muscular branches from the cervical plexus supply prevertebral and lateral vertebral muscles, which include the rectus capitis anterior, rectus capitis lateralis, longus colli, longus capitis, scalenus anterior, medius, and posterior. Sternocleidomastoid and trapezius are not just supplied by the accessory nerve but are also supplied by cervical plexus, which contributes to their nerve supply. The cervical plexus also contributes to the formation of Ansa cervicalis, and the Ansa cervicalis innervates the infrahyoid muscles, that is sternohyoid, sternothyroid, and the inferior belly of omohyoid. Phrenic nerve is a major branch of cervical plexus which supplies the diaphragm with both sensory and motor innervation. It arises from the anterior rami of the third, fourth, and fifth cervical spinal nerves. Brachial plexus. Brachial plexus is yet another network of nerves present in the neck. Cervical plexus is formed from first to fourth cervical spinal nerves, while the brachial plexus is formed from fifth to eighth cervical spinal nerves and the first thoracic nerve. The brachial plexus traverses through the supraclavicular part of the posterior triangle, and then it leaves the posterior triangle to enter the axilla. Brachial plexus supplies the upper limb, both the skin and the muscles of the upper limb. Ansa cervicalis. This is Ansa cervicalis, which is a thin loop of nerve present on the anterior wall of the carotid sheath. It is formed from a superior root, which is this, and an inferior root, which is this. The superior root is derived from the first cervical spinal nerve whose fibers are distributed through hypoglossal nerve. This is the hypoglossal nerve which distributes the fibers of first cervical spinal nerve into the superior root of Ansa cervicalis. The superior root of Ansa cervicalis then descends over the internal carotid arteries and the common carotid arteries. The inferior root of Ansa cervicalis receives the fibers from the second and the third cervical spinal nerve, and the inferior root descends over the internal jugular vein. The superior and the inferior roots join to form the loop of the Ansa cervicalis. Ansa cervicalis supplies the infrahyoid muscles. The superior root gives a branch that will supply the superior belly of omohyoid, and the inferior root will give a branch that will supply the inferior belly of omohyoid. The loop of Ansa cervicalis gives two branches that supply the sternohyoid and the sternothyroid muscles. Thyrohyoid, which is yet another infrahyoid muscle, will be supplied by the first cervical spinal nerve, whose fibers are distributed directly through hypoglossal nerve. This is the hypoglossal nerve which carries the fibers of the first cervical spinal nerve that is distributed to thyrohyoid muscle. These fibers are also distributed to geniohyoid muscle, which is actually a suprahyoid muscle. So via Ansa cervicalis, the muscles that are supplied are the superior and the inferior belly of omohyoid, sternohyoid, and sternothyroid, while thyrohyoid is directly supplied by the first cervical spinal nerve whose fibers are distributed through hypoglossal nerve. Students, don't forget to like this video and subscribe to the channel to stay updated with the latest exam questions. Sympathetic nervous system. The autonomic nervous system has two components, and they are the sympathetic nervous system and the parasympathetic nervous system. Sympathetic nervous system consists of two ganglionated trunks on either sides of the vertebral column. These ganglionated trunks consist of the following ganglia: 3 cervical, 10 to 12 thoracic, 4 lumbar, and 4 to 5 sacral ganglia. The preganglionic fibers arise from the lateral horn of the first thoracic to second lumbar segments of the spinal cord. Preganglionic fibers reach the sympathetic trunk via the white rami communicans. These are the white rami communicans through which the preganglionic fibers are conveyed from the spinal cord to the ganglias. The preganglionic fibers from the lateral horn of the spinal cord reach the sympathetic ganglia. They synapse on the neurons present in the sympathetic ganglia. The postganglionic fibers that arise from the sympathetic ganglia are distributed by one of the two means. Either they enter the spinal nerve via gray rami communicans and are distributed along with the spinal nerve, or they are distributed as a plexus around the arteries to reach the target organs. The function or the area of supply of the postganglionic fibers arising from the sympathetic nervous system are sweat glands, erector pili muscle, the cardiovascular system, that is the heart and the smooth muscles in the walls of the blood vessels, smooth muscles in the viscera, that is the gastrointestinal tract, urogenital tract, and in head and neck it innervates the iris and the eyelids. Cervical sympathetic nervous system. The sympathetic trunks consist of two parallel cords that run from the base of the skull till the coccyx. Along the way they are punctuated by ganglia, which is a collection of neuronal cell bodies present outside the central nervous system. The cervical part of the sympathetic trunk consists of three ganglia, and they are the superior cervical ganglia, the middle cervical ganglia, and the inferior cervical ganglia. These three cervical ganglia are located anterior to the longus colli muscle and also to the longus capitis, and they are present posterior to the carotid sheath that contains the common carotid artery and the internal carotid artery. The cervical sympathetic ganglia are connected to each of the cervical spinal nerves by gray rami communicans. There are three cervical sympathetic ganglia, but there are 8 cervical spinal nerves. All these 8 cervical spinal nerves receives postganglionic fibers from these 3 cervical ganglia, and the preganglionic fibers for the 3 cervical sympathetic ganglia originate in the lateral horn of the upper thoracic spinal segments, that is from L1, L2 segments of the spinal cord. The postganglionic sympathetic fibers are distributed via branches from this ganglia. Superior cervical ganglia. This is the superior cervical ganglia. Here, this is the superior cervical ganglia, which is the largest of the 3 cervical ganglia. It is formed by the fusion of the upper 4 cervical ganglia, that is first, second, third, and fourth cervical ganglia, fused to form the upper cervical ganglia or the superior cervical ganglia. It is spindle shaped and lies opposite the second and the third cervical vertebra. It is present behind the carotid sheath and in front of the prevertebral fascia, just below the skull. The branches and the area of supply of superior cervical ganglia. The superior cervical ganglia gives branches that forms a plexus around the internal and the external carotid arteries. These branches are distributed to dilator pupillae muscle, and also it is distributed via the branches of the pterygopalatine ciliary submandibular and otic ganglia to supply the areas supplied by these ganglia. The branches of the superior cervical ganglia are also distributed through the cervical spinal nerve C1 to C4. The superior cervical ganglia also gives branches that forms pharyngeal plexus around the pharynx. Superior cervical ganglia supplies the heart as superior cardiac nerves. Middle cervical ganglia. Middle cervical ganglia is very small. In fact, it is the smallest of the three. It is formed by the fusion of the fifth and the sixth cervical ganglia. It lies opposite the sixth cervical vertebra behind the carotid sheath above the inferior thyroid artery. The branches of middle cervical ganglia includes the gray rami communicans to the cervical spinal nerves C5 and C6. The postganglionic fibers are distributed via the fifth and the sixth cervical spinal nerves. Middle cervical ganglia also supplies the thyroid and the parathyroid. It gives tracheal and esophageal branches. It also gives a branch to the heart as the middle cardiac nerve. Inferior cervical ganglion. This is the inferior cervical ganglion. Inferior cervical ganglion is formed by the fusion of the seventh and the eighth cervical ganglia. When the first thoracic ganglia fuse with it, it is known as the cervicothoracic ganglia or stellate ganglia. It is called stellate ganglia because it is star-shaped. The location of the inferior cervical ganglia is between the transverse process of the seventh cervical vertebra and the first rib. It is present behind the origin of the vertebral artery. The branches of inferior cervical ganglia are the gray rami communicans from the inferior cervical ganglia passes to the cervical spinal nerve C7 and C8. The vertebral branch forms a plexus around the vertebral artery. Subclavian branch forms a plexus around the subclavian artery. Inferior cervical ganglia supplies heart as the inferior cardiac nerve. Horner syndrome. Horner syndrome is caused by a lesion in the sympathetic trunk in the neck. It results in the sympathetic dysfunction, which is characterized by 5 typical features. The 3 prominent features of Horner syndrome are meiosis, partial ptosis, and anhidrosis. Meiosis is pupillary constriction due to paralysis of dilator pupillae muscle. If we compare the pupil of this eye with this one, we find that it is constricted here. So pupillary constriction, partial ptosis, where there is drooping of the upper eyelid due to paralysis of the superior tarsal muscle of the levator palpebrae superioris. Anhidrosis, where there is absence of sweating on the ipsilateral side of the face due to absence of innervation of the sweat glands. So, the prominent features of Horner syndrome are meiosis, ptosis, and anhidrosis. Other symptoms are there is sinking of eyeball in the bony cavity, and there is loss of cilio-spinal reflex, that is pinching of the skin on the nape of the neck does not produce dilation of pupil which normally takes place. In this tutorial, we have covered the cervical plexus and ansa cervicalis, followed by brachial plexus in brief, and then the cervical sympathetic system. Further, we will cover the cranial nerves in the neck. Glossopharyngeal nerve. This is the glossopharyngeal nerve. Glossopharyngeal nerve is the ninth cranial nerve that leaves the cranial cavity by passing through jugular foramen. It enters the neck where it descends between the internal carotid artery and the internal jugular vein. It curves around the lateral border of stylopharyngeus muscle. This is stylopharyngeus. After that, it passes forwards and then it passes deep to hyoglossus muscle. This is the hyoglossus muscle. Finally, it reaches the base of the tongue and the area of the palatine tonsil, where it is sensory to the structures. The area of supply of glossopharyngeal nerve is stylopharyngeus muscle. Stylopharyngeus muscle is the only muscle that is supplied by glossopharyngeal nerve. Glossopharyngeal nerve is sensory to carotid sinus, pharynx, and to the posterior one-thirds of the tongue. Vagus nerve. This is the vagus nerve, which is the 10th cranial nerve. Vagus nerve leaves the cranial cavity by passing through jugular foramen, after which it enters the neck. In the neck, it travels within the carotid sheath. In the upper part of the neck, it is present between the internal carotid artery and the internal jugular vein within the carotid sheath, and in the lower part of the neck, it is present between the common carotid artery and the internal jugular vein, again within the carotid sheath. Innervation or area of supply of vagus nerve. Vagus nerve is the longest cranial nerve that descends through the thorax and then into the abdomen. It supplies several structures, including structures in the thorax and abdomen. However, in the neck, it supplies pharynx, larynx, and carotid body. Accessory nerve. Accessory nerve is the 11th cranial nerve. This is the accessory or the 11th cranial nerve. Accessory nerve exits through the jugular foramen. Three nerves exits through the jugular foramen, that is the 9th, 10th and 11th cranial nerves, out of which 11th, that is the accessory, is the most posterior of the three. Accessory initially descends between the internal jugular vein and the internal carotid artery. It then passes over the lateral surface of the internal jugular vein and further passes downwards and backwards beneath the sternocleidomastoid muscle. It emerges from the posterior border of sternocleidomastoid muscle to enter the posterior triangle of the neck. It crosses downwards and backwards in the posterior triangle of the neck to pass deep to the trapezius muscle. The area of supply or innervation of accessory nerve is sternocleidomastoid muscle and the trapezius muscle. Hypoglossal nerve. Hypoglossal nerve is the 12th cranial nerve. This is the hypoglossal nerve. Hypoglossal nerve exits the cranial cavity by passing through hypoglossal canal. After that, it descends in the neck between the internal carotid artery and the internal jugular vein. It descends and then it hooks around the occipital artery. This is the occipital artery. After hooking around the occipital artery, the nerve passes lateral to first the internal carotid artery and then the external carotid artery. The nerve further passes downwards and forwards, passing deep to the stylohyoid muscle and the posterior belly of digastric. After that, it further passes forwards and then finally it disappears by passing medial to the hyoglossus muscle. Hypoglossal nerve supplies the muscles of the tongue. Transverse cervical nerve. This is the transverse cervical nerve. Transverse cervical nerve is a branch of the cervical plexus arising from the anterior rami of the second and the third cervical spinal nerves. It emerges from the posterior border of sternocleidomastoid muscle near the middle of the muscle. It then loops around the sternocleidomastoid muscle to cross its anterior surface in a transverse direction. It continues transversely across the neck and supplies a large area of skin of the neck. The questions that may be asked in the examination from the topic nerves of the neck include: Ansa cervicalis is a frequently asked question, cervical plexus, Horner syndrome. Any of the cervical sympathetic ganglion may be asked, out of which superior and inferior are asked more frequently. Transverse cervical nerve, cranial nerves may be asked.